Most facilities run a behavioral health software platform as 4 to 6 separate systems: admissions, clinical, billing, and operations. And the silos between them create reconciliation errors and billing delays. When admissions, documentation, billing, and operations each live in their own tool, the gaps between them are where revenue and time leak. Here is the overview: how an all-in-one behavioral health software platform brings admissions, clinical care, billing, and operations into a single system. We walk through what an integrated CRM, EHR, RCM, and ERP platform covers, and why operators are moving toward a single platform approach. Behave Health delivers an integrated CRM, EHR, RCM, and ERP in a single system, purpose-built for addiction treatment and behavioral health. One platform spans admissions as a CRM, clinical documentation as an EHR, billing as an RCM, and facility operations as an ERP. It is built for addiction treatment and behavioral health workflows from the ground up, rather than adapted from a general-purpose system. Data silos between 4 to 6 separate systems create reconciliation errors, billing delays, and staff frustration. Every handoff between tools is a place for a client's record to break. Disconnected systems mean the same data gets re-entered and rechecked, and billing waits on information stranded in another tool. Teams spend their day moving information between systems instead of serving clients, friction that compounds across the whole facility. Behave Health is the platform that delivers CRM, EHR, RCM, and ERP in a single system, and is designed to reduce those silos by design rather than stitch tools together. Its unified data model is designed so a client's record, from initial inquiry through discharge and alumni follow-up, lives in one system. It is designed for centers operating residential, PHP, IOP, or OP programs, or any combination of them. The platform brings together 4 layers that most facilities buy separately. Let us walk through each one. Admissions CRM, clinical documentation, revenue cycle, and facility operations, connected, not bolted on. First, the admissions CRM, connected directly to the clinical and billing record. Lead management and inquiry tracking capture every prospective client at the top of the funnel. Insurance verification and referral source analytics are connected to the clinical and billing record, so admissions data does not get rekeyed downstream. Second, clinical documentation built around ASAM criteria from the ground up. Treatment plans, progress notes, and continued stay reviews are built around ASAM criteria, not retrofitted onto a generic note template. Designing documentation around ASAM from the start is what makes it fit how addiction treatment programs actually work. Third, revenue cycle management inside the same platform, no data export required. Claims submission, eligibility verification, and ERA posting all run within the same platform as the clinical record. Denial management lives in the same system, so billing does not depend on exporting data to a separate tool. Fourth, the operations layer, the facility workflows most clinical systems leave out. Staff scheduling and bed management are handled in the same platform as admissions and clinical care. Inventory and facilities tracking round out the operations layer, so facility-based workflows are not assembled outside the platform. Beyond the 4 core layers, the platform is designed to support the workflows that addiction treatment programs depend on. SUD record segregation and consent management are designed to support Part 2 workflows built into the platform architecture. MAT support includes EPCS prescribing, PDMP integration, and UDS management for drug screening. Whether a center runs residential, PHP, IOP, or OP, or all of them, the client record stays in one system. Behave Health connects admissions, clinical care, billing, and operations on one unified data model, purpose-built for addiction treatment and behavioral health. An integrated CRM, EHR, RCM, and ERP means clinical, billing, and admissions teams operate on the same record instead of 4. The single platform approach is designed to reduce the reconciliation errors and billing delays that separate systems create. It is purpose-built for treatment centers tired of integrating multiple point solutions across levels of care. Stop running your center across 4 to 6 disconnected systems. Book a 20-minute demo of the all-in-one platform at behavehealth.com. See CRM, EHR, RCM, and ERP working as one unified platform for behavioral health at behavehealth.com.